Hi, good morning. It's so exciting to see everyone here interested in learning more about glaucoma. And I want to say special thanks as well to everyone who did so much work to put this nice conference together. My name is Alice Williams. I'm one of the clinical fellows this year in the glaucoma service. And I'll be speaking about the different types of glaucoma and where they tend to occur in the world. So it's estimated that in 2020 there will be 80 million people in the world with glaucoma. The vast majority of these people will have what's called open-angle glaucoma, and this is a large basket term to describe this most common type of glaucoma. Open-angle glaucoma is most prevalent in people in Africa and those of African descent. It's estimated that about 4% of all people in Africa have open-angle glaucoma. In Japan, that rate is quite high as well. It's about 3%. In Latin America, 3% as well. In Europe, the rate is a little bit lower. About 2% of the population overall has been diagnosed with glaucoma. And in India, 1.75%. In China and Asia, 1.3%. And in the United States, because we are a melting pot, that figure will vary from 2 to 4% of the population, depending on your ethnic background. So open-angle glaucoma, as we said, is the most common form of glaucoma. And it's called open-angle glaucoma because as a physician, when we look at the drainage system of the eye, it appears open. It can appear quite normal. But we know that there's a blockage, there's a resistance to flow in the trabecular meshwork, those cells that make up the drainage system. Open-angle glaucoma can be primary, meaning that there's nothing to cause it that we know of besides your own genetics. Or it can be secondary, meaning that it's caused by something else. And we'll go through those different types of glaucoma to understand those better. This is just a little review of that drainage system that I know has been talked about earlier this morning. And the drain of the eye is located right here where the iris meets the cornea. And that's where we think that there's a blockage that stops the fluid from leaving the eye and can cause the pressure to go up. So primary open-angle glaucoma, as we mentioned, that very common type of glaucoma that has no direct cause, is typically asymptomatic. Your peripheral vision is affected first, and so someone with glaucoma may not realize that they have this until it's very advanced. Risk factors for open-angle glaucoma are age, family history, higher intraocular pressure, and then some other things that eye doctors can note on exam, like the thickness of your cornea and your glasses prescription. So people who are nearsighted are a little bit more likely to develop glaucoma. So going into the types of secondary glaucoma, these special types of glaucoma that have a specific cause, the most common is something called pseudo exfoliation glaucoma. There is a genetic predisposition to this. It's much more common in people of Scandinavian descent. It can also be common in the Arabic Peninsula. And interestingly, there have been studies showing that in South Africa and Ethiopia, it's actually fairly common as well. So in pseudoexfoliation glaucoma, there is an abnormal protein that collects in the eye. And you can see on this picture here, this is a picture of the lens of the eye. There's this white ring that forms because that protein is collecting on the lens. That protein can collect on the lens, on the iris, and it can also block up your trabecular meshwork, the drainage system of the eye. So when the protein blocks up that system, it can cause the fluid to back up in the eye and the pressure to go up. The next type of glaucoma is called pigmentary glaucoma. Risk factors for this, it's a little bit different than primary open-angle glaucoma, which tends to affect older people. Pigmentary glaucoma actually common occurs in young males who are in their 30s and 40s. It's more common, again, in people who are nearsighted, and it's actually very rare in African Americans, but it can affect any other type of person. In this type of glaucoma, there's a problem where pigment rubs off the iris, so that pigment gets spread throughout the eye, and again, it can block the drainage system. It can block that up so that the pressure in the eye goes up. Another type of glaucoma is something called inflammatory glaucoma. This, again, can happen to someone of any age. And there's typically an underlying condition that causes this inflammation or swelling in the eye. People with autoimmune conditions can be prone to swelling in the eye. People with herpes infections or shingles infections as well. So anyone who's had shingles around their eye needs to see an eye doctor right away because they can get inflammation, which can lead to glaucoma. Also, anyone who has used steroids in the eye for these inflammatory conditions is at risk for developing glaucoma as well, because that can lead to higher pressures in the eye. The next type of glaucoma is caused by trauma. And that can happen by two different ways. So you might have been asked at some point by your eye doctor if you ever hit in the eye, even when you were younger. Because any large hit to the eye which causes serious damage can damage that drainage pathway of your eye again. Also, if there's bleeding in the eye after getting hit in the eye, that can clog up the drainage pathway and cause your pressure to go up. Last type of open angle glaucoma that we'll talk about is something called normal tension glaucoma. And this happens when you develop glaucoma, you develop damage to the optic nerve and trouble with your vision, despite the fact that your intraocular pressures are always normal. And that can be a tough thing to treat because it seems like your pressures are in a good range, but they're not low enough for you. This type of glaucoma can happen to any ethnicity, but is particularly common in Japan. About 90% of all Japanese people who have glaucoma have this normal pressure glaucoma. Risk factors for this are migraines, something called Raynaud's phenomenon. So Raynaud's happens when people who are very, very sensitive to the cold. Anyone's fingers might get cold when it's chilly out, but if your fingers get so cold that they go white, then that's called Raynaud's, and that's a risk factor for having this type of glaucoma. Sleep apnea and having low blood pressure can also be risk factors as well. Finally, I'll just mention briefly, as we said, most of these types of glaucoma affect older folks, but there are types of glaucoma that can affect children and even young babies right when they're born. So congenital glaucoma often is symptomatic at start. Babies can have very cloudy corneas that look abnormal. They can also just have obvious vision problems or just have light sensitivity or tearing. So any baby that seems to be having trouble with their eyes or with their vision needs to be seen by an eye doctor right away. And then juvenile glaucoma can affect people, even very young children and adolescents. So those were all types of open angle glaucoma. The other big category is something called angle closure glaucoma, and that affects 26% of people, of those who have glaucoma in the world. This is actually, interestingly, most common in people of Inuit descent. It affects about 4% of the population there. The next most common group is in China and Southeast Asia and India, so it affects about 1.3% of the population there. In other parts of the world, it's much less common, but again, it can happen to anyone. So angle closure glaucoma is termed that way because in this type of glaucoma, the drainage system of the eye is actually blocked. So when an eye doctor looks at your drain, it is physically blocked by the iris so that fluid can't get out of the eye. And that's why the pressure in the eye goes up. And this can, just like open angle glaucoma, can be totally asymptomatic. You can have it for years and not be aware, or it can present suddenly, and we'll discuss that in a moment. Risk factors for that are age, again, as we talked about, Asian and Inuit heritage, and this type of glaucoma does more commonly affect people who are farsighted. So no matter what your glasses prescription, you don't get out of having some risk factor for glaucoma, unfortunately. So this just shows where that blockage is. The iris blocks that drainage pathway of the eye so that the fluid can't get out and the pressure goes up. So as I mentioned, angle closure glaucoma can be asymptomatic, but it can present acutely. So anyone who has a sudden onset of a red eye, severely painful, the vision is down, they need to be seen by an eye doctor right away. And this happens when your drain is open and it becomes blocked suddenly. So you can have a normal pressure your whole life, and then you wake up one morning and your drain is blocked. Your pressure might go up very high, up into the 40s or 50s. And when the pressure rises suddenly like that, it can be very painful and symptomatic. Another type of angle closure glaucoma is called neovascular glaucoma. And that's when abnormal blood vessels actually grow across and block that drainage pathway in the eye. This has a lot of different causes. It can be caused by diabetes, retinal artery or vein occlusions, sickle cell anemia. So anyone who has this type of glaucoma, we typically do refer them to their primary care doctor to find out what caused it. So in conclusion, I know we kind of really sped through things today. There are many different types of glaucoma. They do vary by different populations, although that's not always a definite indication of what type of glaucoma you have. Most cases are asymptomatic until late. But with any symptoms, you certainly need to be seen by an eye care provider right away. So thanks again, everyone, for coming today.